Hi, I'm Dr. Tony, the Chief Cosmetic Surgeon from ICCM in Macquarie Street, Sydney. I'd like to talk to you today about our special technique for facelifting, which we call the MACS lift. It's actually not our invention. The MACS lift was invented in Belgium about 15 years ago by a very well-respected plastic surgeon. It's a technique that I've been employing for about the last 8 years or so, and I find it to be really effective. It's what we might term a superficial plain facelift. In other words, we're not digging down into the deeper structures in order to achieve the lifting, but we are still making an incision in front of the ear. It's a shorter incision than the one that was traditionally used for facelifting. So it's what we call a short scar facelift, and we're staying above the next layer down, which is called the SMAS. That's a layer that's involved in supporting all of the soft tissues of the face. We can actually put purse string sutures into the SMAS to elevate it and tighten it, and we anchor those purse string sutures to the cheekbone just here in front of the ear. It's very important that the SMAS layer be lifted, because if you just try and pull on the skin, you're not really going to get a very effective facelift. It may look good for a couple of years, but after that the effect is all going to disappear. So the MACS lift does lift and elevate and tighten the SMAS layer, and therefore it's a true facelift. Even though the scar is shorter, the procedure takes less time, and it's inherently less risky because we're not going down into the deeper layers of the face. Pretty much these days, that's the only type of facelifting I like to do. I know there are a lot of surgeons out there who feel very comfortable doing the deep plane facelift. Personally, I find that the MACS lift, which is the one I've just been talking about, is a very effective facelift that gives great results, very natural looking results that last for several years. We would normally say 8 to 10 years of great results with a MACS lift. It's inherently less risky, the recovery time is quicker, the scar is shorter and usually very well hidden. We just hide it in the contours of the actual ear. And generally speaking, I think that this is a really great modern facelift, and I'm very happy to do it here. So who's a suitable candidate for a facelift? I would say that the majority of my patients are somewhere between 40 and 60 years old. It's obviously going to depend very much on how much facial aging they have experienced. One of the facts of life is that living in Australia, you get a lot of sun exposure, a lot more than growing up in some other countries, and this does tend to create more sagging and more of an aged appearance earlier in life. I've done facelifts on patients in their 70s, and there's no problem with doing that as long as the patient is medically fit to have a lift. So really there's a very broad range of ages of people that might be suitable for a facelift. I've even done this MACS lift on clients who have already had a facelift, and that's quite possible as well. It's entirely possible to do that. Generally speaking, the best results will come with patients who've got saggy jowls and sagging in the lower part of the mid-face here. And it also is very effective on the sagging neck. Sometimes if the neck is very dropped, we might combine the MACS lift with a little central tuck procedure to the neck down here, which is made in a separate, through a separate incision just behind the chin. So that can add a little bit to the time involved and the cost of the procedure. But obviously we're going to recommend to the individual client whether they're going to need that little extra tuck or not. You might need probably about 2 weeks off work, although you'll find that most of the healing is done by about day 10.